So let's talk about respirations. And so whenever you're counting a patient's respirations, you're actually letting your nurse know how well this patient's breathing. And so a normal respiration rate for an adult is 12 to 20 breaths per minute. And so a breath would be one inhalation. We're actually breathing in oxygen, and then one exhalation. So in and out. Breathe in oxygen, let out CO2. And that would be the full process. So as far as your patient's concerned, whenever a patient takes a deep breath in and then they release it, that process would be one breath. In, out, one. So if your patient's respiration rate is lower than 12, maybe you need to stimulate them, try to wake them up a little bit, but don't be afraid to notify your nurse. Get your nurse in the room, because whenever we're giving pain medications or sedatives will relax your patients, but it also causes them not to breathe as effectively. And then if a patient's anxious, maybe they're having an anxiety attack, or if they're having a lot of pain, their respirations may increase. So remember, 12 to 20 is the normal range. Anything outside of that, let your nurse be made aware. And so now we're going to focus on Mrs. Loretta's respiration rate. Whenever you take your test, don't forget you do the whole introduction first, and then after your introduction, which includes hand washing, you can tell your patient to relax. If you're having difficulty with seeing your patient's chest rise and fall and they are laying flat, you can sit them up. Opposite, if they're sitting up and you can't see the chest rise and fall or the stomach rise and fall, you can lay them flat. But play with the position as you need to in order to make sure that you get an accurate respiration rate. And then one more thing that I want to discuss is that you cannot let your patient know that you are going to be counting their respiration. So what we say instead is a blanket term. My name is Eunice. I'm your CNA today, and I'm here to take your vital signs. Is that okay?
Yes, ma'am.
So you want to keep the element of surprise, because if you tell them that you're here to count their respirations, they stop breathing on you. They're like looking at you, looking at them. So I'm going to go ahead and begin Miss Loretta's vital signs, aka respiration, shortly. All right, so Miss Loretta, is it okay if I hold your wrist?
Yes.
Right. And I'm holding her wrist to keep the element of surprise. I'm not holding her wrist because I'm actually taking the pulse. Instead, for the next 60 seconds, I'm going to look at her chest rise and fall. And I know what you do in the real world. You lie about the respiration. Stop lying. Everyone's respiration rate isn't 14. Stop documenting that. We can check the chart history and see that you're not telling the truth. So really count your patient's respirations, because again, if it's too low or it's too high, you could be the person that helps protect your patient from maybe receiving too much medications. And so now we're going to focus on the chest rise. All right, pretend that I'm still holding the wrist. For video purposes, I'm going to be counting with you. All right, and we're going to start now. 1, 2, 3, 4, 15, and 16. All right, and so now that you've actually taken the respirations, of course, you can give your patient back the call bell. Don't forget to document your findings, wash your hands, and open up the curtain if you had closed it. And so far we have covered temperatures, pulse, respiration, our pain assessment, our O2 saturation. So the last skill we'll be covering will be blood pressure. So we'll see you in a few moments.